Before the surgery, you will receive a regional anesthetic. You will remain awake, but the lower half of your body will be numb. The most common reasons for performing a C-section include labor that is not progressing, signs that the baby may be in distress, and an abnormal fetal position such as breech or transverse. A typical C-section lasts around 45 minutes. During the first 10 to 15 minutes, the baby is delivered, and the remaining time is used to carefully close everything back up. The procedure begins with an incision through the skin and underlying fat tissue. The doctor usually makes a small horizontal incision just above the pubic hairline, about 10 to 15 centimeters long. Beneath this layer is a strong layer of connective tissue called the aponeurosis. This tough layer covers and supports the abdominal muscles. Once this layer is opened, the abdominal muscles are reached. These muscles are not cut, but gently separated by hand. This helps reduce muscle damage and can make recovery easier. Behind the muscles is a thin membrane called the peritoneum. This membrane is carefully opened so the surgeon can reach the uterus. A small incision is made in the lower part of the uterus. This area is chosen because it generally heals well and lowers the risk of complications in future pregnancies. Inside the uterus is the amniotic sac, which contains the baby and the amniotic fluid. At this point, the surgeon has carefully passed through 7 layers. In this case, the amniotic fluid is green due to the presence of meconium, which is the baby's first stool. This can be a sign that the baby experienced some stress before birth. Once this sac is opened, the fluid is released, and the baby is carefully lifted out through the incision. Gentle counterpressure may be applied to help guide the baby out safely and smoothly. The umbilical cord is clamped and cut, and the baby is handed to the medical team for assessment and care. After delivery, the surgeon carefully inspects the inside of the uterus using their hands. They gently feel along the uterine wall to make sure there are no tears or ruptures. The placenta is then carefully removed with gentle traction. Once everything has been checked, the uterine incision is stitched closed, and the surgeon proceeds with closing the remaining layers of the abdomen. Finally, the skin is closed with stitches or staples. The incision typically heals within about 2 weeks, but the deeper tissues, including the uterus and abdominal wall, take longer. Full internal healing takes about 6 weeks. Thank you for watching. If you'd like to learn more about pregnancy and childbirth, feel free to check out my gynecology playlist.